if you're having any technical problems, also please let us know in the chat. Hey, I see some people that I know. Thanks for saying hi. Hi, Parvati. Nice to see you again. Welcome, everyone. Great to have you here. Hi, Nelson. Hi, everyone. Very welcome to this Where Next webinar, where I will be answering common career development questions in global and in public health. And let me start very briefly as people continue to join in by talking about a little bit about my own story. I started my career in the biomedical sciences. Actually, I started studying microbiology and virology and doing all my graduate degrees in this area. And almost 12 years ago already, I decided that I'd had enough and that I wanted to get out and that I wanted to change careers. I had a vague idea that global or public health might be something I might be interested in, but I was not really very clear on it. So I know many of you are in a similar situation. You're career switchers, as we call ourselves. So this talk or this webinar is also for you. The reality is that I started having conversations with a lot of people, and that helped me become a little bit clearer on where I wanted to go next. And then I started sending out job applications for positions in global or public health, and I started getting rejection after rejection after rejection, or zero answers, which can be extremely difficult to deal with. Luckily, I got a break and I was hired by a hospital as a public health professional. This was in Mexico City, and I was in charge of leading a team of people focusing on social determinants of health, helping patients with problems outside of their health problems. So that was very interesting. And after that, over the span of many years, I've been working with NGOs, with multinational organizations, with the UN, with universities, with startups. So I know quite a little bit about the variety of possibilities in global and public health, and I'm happy to talk about that today. So I wanted to answer the question, why this webinar? And the thing is, for some years now, I've been either formally or informally mentoring people and just jumping in to have coffee with people who are either new to the global and public health fields or are still doing their studies, their masters, and they come with many similar questions, which to me shows that inside our master's programs, we're not doing enough to address career development issues for the students. So with this webinar and with some different tools and trainings that we are developing at Talanda, we are aiming to do our part to help global and public health professionals find jobs and find a career path that really motivates it. Because I think, if the pandemic has shown us anything, is that we really need motivated and engaged young public and global health professionals. And we need to get them into jobs, and we're not doing a very good job out of it. So I hope this webinar helps. How are we going to structure this? I'm going to start by answering 3 common career development questions that I get a lot. And then we'll have around 20 minutes for any questions that we have from you and that we've received via email already. So feel free, think up your questions, and then you can start typing them in the chat right now, or as you hear me speaking, you might have follow-up questions. So you can just add those to the chat and we'll tackle them next. And at the end, I'm going to talk about some other tools and courses that we have at Talanda that might also be of interest. Okay, so let's get started. And I see that we are already at 45 participants. That's great. What I want to talk, one of the most common career development questions that I get is, what are my options outside of academia? And I think for most of us, our options inside academia are quite clear because we did a master's or we're doing a master's in public and global health. But what about outside it? Like sometimes our professors, they are researchers in academia as well, so they can't really answer this question very well for us. And that's fair enough. Let's talk about that. First, you can work in a variety of different sectors, right? You could work for the government, and this means anything from the Ministry of Health to the most local health authority in your country or in the country where you would like to work. This is normally jobs that are quite meaningful because you can impact a lot of people. Salaries tend not to be very good in low and middle income countries. In particular, there could be a little bit of pay instability, but they can be quite meaningful and you can have quite a lot of impact. The downside again is bureaucracy. We all know how bureaucracies in our own governments work, so we need to take that into consideration. Getting things done can be a bit challenging sometimes. You can work in not-for-profit organizations. And not-for-profit organizations, of course, the first thing there's universities, there's research centers, that would be sort of like the academia section, but we have a lot of NGOs, non-governmental organizations, or charities or foundations. And these can work in public health issues, so health issues inside a country, or in global health issues, so health issues that pertain to that are related to poverty issues around the world, but that are also related to pandemics and issues that affect the whole world instead of a single country. The big NGOs you probably heard about, you have the Red Cross and Red Crescent movement, you have Save the Children, you have CARE, you have Oxfam. Most of the big NGOs have some sort of health sector, so global health programs. But you also have a lot of much smaller NGOs that can also work in several different countries or in a single country. So look up those in your country, and if you type in NGOs health, you'll get plenty of responses. That type of work can be very nice, and it might be a mix of technical advice and actually coordinating or implementing or managing projects, depending on where you're based. You can also work for startups, for example, and these can be health tech startups, and there's plenty of this. So just, get into the startup environment in your own country. Look it up a little bit. They tend to be some of the most welcoming people because a lot of these business people, they don't care what your degrees are. They just care about getting things done. So if you're motivated and you're interested, and they will be interested in you joining them. The downside is that very small startups, very new startups might not have a lot of money to pay salaries. But there's all size startups. There's some that have been there for a few years already, so they might have a little bit more resources. So I really recommend looking at the startup environment, especially if you're interested in health tech or digital health. There's a lot going on there, but there's other projects that are more global health oriented and not necessarily just tech or digital things. You could work also for multinational organizations. And a multinational organization is an organization that works in 3 or more countries, or that brings together 3 or more countries. We typically think about the UN system as a multinational organization. You have WHO, you have UNICEF, but you have many other agencies that also have health components. So you can look into those. The International Organization for Migration, the World Food Program, even UNDP. So there's quite a bit of options there. Very good salaries, hard to get in. Harder if you're actually applying for a job, easier if you're applying for a 1-year contract or a consultancy. So they tend to hire a lot of consultants that are actually working full-time as consultants for a single year. And this is because positions are limited. but it's a very good way of going in because it's not as high risk for them and not as high risk for you either if you're not interested. There are other multinational organizations. You probably know about Gavi, the Vaccine Alliance. Now there is a Coalition for Epidemic Preparedness Innovation, CEPI, which is based in Norway and London, but they have offices in different countries. They've been very active during the pandemic in trying to get, they are the basis of COVAX. So that's an interesting one. You have the Global Fund for AIDS, Tuberculosis, and Malaria. And there's a lot of positions because many of these have offices in a number of countries. So look those up. There's also the banks, like the development banks, the World Bank and the regional development banks in each continent. What else is there? You have a lot of small local NGOs that you might want to look into that are doing fantastic work with very little resources. And you have foundations, either international foundations like the Bill and Melinda Gates Foundation that everybody's heard about, but many countries have foundations, this is especially true in the US, that fund some health programs. So you could be like a grant manager or a project manager for these health programs. Someone's asking me when I say type it in. Yes, you can type it in on LinkedIn, but you can also type it in on Google. Just Google things up, and it takes a little bit of tweaking to find the right terms. And change the settings depending on the country that you are in, so you can get results in English or in different countries and not just locked in for your own country. And you'll get some good responses there on Google. Great. And the other thing never to forget is you can go out on your own. You can start your own business or your own NGO or just start as a freelancer, just providing support services in global or public health. I hope this gives you a little bit more variety, a little bit more ideas of on what are the type of options that you have for a job or a career in global and public health. Some of these are more governance oriented, more health policy oriented. Others are more hands-on. Usually the smaller the organization, the more hands-on you will be. The larger the organization, the more, there might be more bureaucracy, more administrative tasks. You might also have a bigger impact, but your part in the puzzle might be smaller in a way. We can talk more about this if you have more specific questions. Let's move on to the second question I get, and that is whether I should be doing a PhD. And if you're just finishing your master's and writing your thesis, you're like, oh my gosh, I don't want to do a PhD. Or some of you might be very excited about a PhD or a DRPH. Which is great. And if that's, that's your thing, that's what you want to do, just go and do it. But if you're having, second thoughts, if you're having questions on whether you need this, I get this question a lot. And the answer is you don't need a PhD or a DRPH for many jobs. So don't do it because you think you require another qualification. Some people ask me these questions after they've had a lot of rejections from job applications or after they have not heard back from a ton of job applications, right? And then if you send out, 50 or 100 job applications and you don't hear back or you just get rejections, you might be thinking, okay, what am I doing wrong? Maybe a master's is not enough. Maybe I need a PhD. No, that's not the solution, okay? Not every single job needs a PhD. And many, you will see that even if they require a PhD, they would be happy to exchange that for the same number of years of experience. Okay, so don't do a PhD just because you're getting rejections to job applications. Good reasons to do a PhD: you want to go into research. You really want to be a researcher, you want to go into academia, then you definitely need a PhD. It's going to help you not just be able to conduct research on your own, but also to have the correct credentials to stay inside academia and climb the ladders in there. Other areas where you might need a PhD is, for example, if your ambition is to get into the highest ranks of, WHO, the World Health Organization, or other international organizations. In those situations, the credentials from a PhD might be important, but again, not all the time. So I think those are two good reasons to go into a PhD. You could also think about it if you would like to work in academia, but not necessarily at a university. So at any sort of think tank organization which primary activity is research. In those cases, and I'm thinking about a CAPS, Gapminder, the Institute for Health and Metrics, these sort of think tanks that are not really universities, but are research organizations. The National Institute of Health in your own country, they might require a PhD, or a PhD might open many doors for you there as well. Outside of these, not so much. Experience also counts a lot, okay? Great. There's coming some comments here. Let me just take a quick look at the chat to see if anything is just relevant right now. In the field of global health, in order to start a PhD, is it necessary to have experience before? No, if you have a master's, you can go directly into your PhD. Most programs will accept you. And then a DRPH is a Doctor of Public Health and is generally intended for mid-career. Yes, it's generally intended for mid-career. Sometimes they will also accept people just out of a master's. It really depends on the university and the program. There's other questions in the chat that I'm going to leave for later, so it's not that I haven't seen them. Okay, someone is asking, I want to indeed switch to public health in the future. How can I find a PhD related to public health and not in basic sciences? Go to universities that have masters in global health or in public health, and then you will see usually you will see the links to their PhDs related to global or public health. And you can also look for a DRPH, which is a little bit different. It's much more operational in nature, and whereas a PhD might be much more research oriented. But again, it really depends on the program and it really depends on the university. So you might want to check out both. Great. Okay, let's move on to the third question that I get the most. And that one is, why do I keep getting rejections or no answers to my job applications? And this is a tough one, and I've been there, and it's horrible. Just as a confession, I probably sent out, in my first year of trying to switch careers, I don't know, 60 plus CVs. And I probably got like 5 responses, and one of them was an invitation for an interview. Quite demotivating. Like, no matter how good your self-esteem, this really triggers us. Like, this is really hard to take. So I get it. The first thing I want to say is that if you are applying to jobs that are advertised online, and that is your only job hunting strategy, you're not going to get much better returns on investment on your time and effort. So it's not so much as your CV or your cover letter is not good enough. It's not so much that your credentials are not good enough. It's usually more about the methodology that you're using to look for jobs or to hunt for jobs. And of course, don't get me wrong, you can always improve your CV, you can always improve your cover letter, and there's plenty of resources out there on the internet, but it's usually more about the methodology you're using. So let me introduce something that I like to call the iceberg analogy. So an iceberg, you have a tiny piece of ice that is above the surface of the water, that is all that you can see, and then the huge mass of ice, the majority of the iceberg is actually underwater and we can't see it. It's very similar when you're looking for jobs, actually. The tiny mass of ice that we see on the surface, those represent the jobs that actually get published in whatever site you're using to look for jobs. The majority of the jobs available never get advertised. And you're going to say, but how is that possible? Where do they find people? Well, they find people internally, or they're actually internally in their own organization or through their networks, or even someone reached out to them, they created a contact, they like a person, and they're like, oh, we really need to bring this person into the organization. This person could be an asset. Let's create a job, a position for this person. This is not science fiction. It actually happens, and it happens a lot. The majority of the jobs never get advertised. So if you're only answering job applications that appear online, you're targeting the 10% of the iceberg that is actually above the water. So your return on investment is going to be really minimal, because everybody else is also targeting that part of the iceberg. Whereas all the other jobs are being filled by people who are creating those relationships and getting to know the organizations and building their networks in order to have more possibilities. And there are some caveats to what I'm saying, the most important of which is many organizations that receive public funds, they are mandated to post every job position. That doesn't mean that they don't have a pre-selected candidate. They can't say this out loud, evidently, but you might be competing against a number of internal candidates when sending in your application. So it's not weird that you never hear back. Now, let's think about it. Like every one of us as a person, imagine that you get a sales call from someone is trying to sell you something. That person, you already know, he's a friend of yours. You are much more likely to hear them out and listen to what they have to say and consider what they want to say because they're your friends. Or even if not your friends, even, it's the friend of your best friend. You have a relationship to them, whether first degree or second degree. So you are going to pause and listen to what that person has to say. Now, you get a sales call from someone you don't know, like, just this sales call, the normal seller where you get a sales call. Oh, do you want a new telephone line or whatever it is? How likely are you going to be to hear them out? You don't know them. You don't owe them anything. Why would you waste your time listening to them? Even if they have the best product out there, you're busy, you have other things to do, you don't really care, you hang up on them. It's exactly the same thing for the people who are who are receiving job applications. If I'm a big organization and I don't know you, I have no relationship to you, you don't know about us, you can't show me that you understand us, why would I call you in for an interview? Okay, so the way to get around that iceberg problem, the way to target those job applications that are underwater is by connecting to people. And this sounds awful and it's a big generalization, but there's two types of people in an organization. There's the HR people, there's the human resources people that are normally gatekeepers. Their job is to let some people in and then keep the majority of those people out. They receive 100, 1,000 job applications, and they're just going to have one candidate, maybe 5 for interviews, right? So their job is to keep the majority of people out. The technical people, the people like you and me, the people who are the global health or the public health specialists in those organizations, they are not usually the ones who are receiving, especially in big organizations, they're not the ones who are receiving those 100 or 1,000 job applications, right? But they have a say in the process. They have a say in the job recruitment process at some stage. So what you want to do is create connections with the people who are your peers, who are global health professionals, public health professionals in that organization. And you don't want to create connections with them by asking them for a job, because then no one's going to want to talk to you. Everybody's afraid of people asking them for jobs, right? what you want to do is just invite them out for coffee. You know, if you're starting your career or if you're switching careers, you need to create a network. And creating that network is where opportunities will come for you, will come to you. How does this work? Make a list of people and organizations that you find interesting. First, if you don't know people, just look at the organizations, the type of organizations that you're curious about, even if you're not sure that that's the type of organization you want to work with. And then find, this is very easy on LinkedIn today, but you can also go to their websites. Find people that are technical people, people in global health or public health or water hygiene and sanitation or whatever it is, that are part of that organization. Reach out to them if you are able to find their email by email, and if not, through LinkedIn, and say, hey, you know, I'm just starting my career. I'm just trying to figure out where I want to go. Your position or what you're doing in this organization sounds very interesting. Would you take 20 minutes to talk to me about your job and how it looks like, and about how you think about the work of this organization? A lot of people will say yes. So if you're polite, if you ask for just a little bit of time, if you phrase it well, and if you're asking for advice instead of asking for a job, most people will say yes. Some people will say no, that's fine. You don't need everybody to say yes. But most of us, we will say yes. We will sit down with you and have a 20-minute coffee, you know, or virtual coffee these days. So that's the way where you can create connections. And then it's not a one-off thing. You build, you nurture that connection, you stay in touch with that person, you think about, you know, can you do something nice for them? Can you repost something that they're posting on social media? These sort of small things. With that, you start building a network. And then, you know, if you see that there's a job application for that organization where you actually have a contact, you can reach out to this contact and say, hey, I saw that this position is coming out. That sounds like a really interesting position. Do you know more about it? Can you tell me more about it? And then you will have some inside information that you can put into your CV. And in your cover letter, you can always say, such and such person who has this position in your organization explain to me these and these things about this job. And I find that is a very good match for me because of A, B, and C. You see how it goes? Having a name gives you a lot of power. It's the same thing as when you get a call from the friend of your friend. You will listen to what they have to say because of your connection to the other person. I hope that makes sense. I am going to stop now and just start answering some questions that have coming in the chat. Give me 1 second here. Okay, so Eileen is asking, give me 1 second. This is getting a bit, oh my gosh, there's a lot of questions. I'm going to try and take them from the start. And Sean and Valerie, please hop in if I'm not doing this correctly. How does a consulting position for a multilateral organization work? Is there a hiring process similar to a regular job? Yes. Most of the times, so there's two types of consultancies, let's say. There's consultancies that actually look like a job. So it's like a 9-to-5 job where you're working full-time for that organization, but it's called a consultancy contract. And this has advantages for the organization because it can be a 1-year contract or an 8-month contract, and they are not responsible, you know, it's not like a hire for several years. So it's much easier to stop that contract if something does not go well. So it has less risk for the organizations, which is why many organizations use these as sort of starting contracts. But that doesn't mean that your relationship to that organization needs to end after that contract, right? They will, you know, they already know you after that. So it's much easier to get into other positions and potentially positions for life, or, you know, contract, a 5-year contract or a 3-year contract or whatever it is. So the process for those looks quite similar. They're usually advertised in the same places where you would have a normal jobs advertised. And it works much in the same way. It's just that it's for a shorter time and it's a different type of contract. It's not an employee contract. So you might not have some of the benefits. And that's an important thing to consider if some of the benefits are, key for you, depending on your life situation. There's another type of consultancies, which is like what we call a project consultancy. So here an organization would hire a freelancer or a small business or a small, an individual for to carry out a particular task. This is, outsourcing basically. This could be a needs assessment, or the development of a training, or the development of a strategy or a policy or an evaluation. There's a lot of possibilities there. These projects are normally based on a certain amount of days or a particular budget and a number of deliverables. And for those, you need to have some sort of structure as an individual to be able to invoice. So that's also a possibility, but I'm thinking many people might start just with, a contract type consultancy, so that look very similar to a job. So yes, you can look for those in the same places where you're looking for other job types. You will find them there. UNICEF, WHO have a ton of this. But again, if you have no relationships and no contacts, they're quite hard to get, I would say. I'm reading. And yes, the hiring process is similar to a regular job, but there might be much less, the interview process might be much shorter, right? Because it's not like they're hiring you forever or for 5 years or for whatever. So the interview process might be simpler. What's the difference between a PhD and a DRPH? Are they the same? I think I already answered this one. Basically, a PhD is much more heavier in terms of research. A DRPH tends to be a little bit more operational. Some DRPH might be shorter. They're more geared towards operational or implementation research. But again, it really depends on the organ or on the university and the program. So don't discard one or the other just because of that title. Look up what it contains first. In the field of global health, in order to start a PhD, is it necessary to have experience before? I already answered this as well. No, many times you can go into a PhD right after your master's. As opposed to what happens in the biomedical or medical fields, I actually feel for public and global health, it might be interesting to have a little bit of experience before going into a PhD or a DRPH. And there's not as much pressure to follow as in the biomedical field or the medical field to just follow that progression, bachelor's, master's, PhD. So it's fine if you stop for a few years and then go into a PhD or a DRPH. I have another question here that says, if I want to indeed switch to public health in the future, how can I find a PhD related to public health and not in basic science? Oh, I already answered this one as well. If you look for the masters in global and public health, usually the universities that have these masters will have some PhD programs for global or public health. They can be called other things, right? Especially like there's community health, international health. They have a variety of different names, but many cover some of the same subjects. Also consider epidemiology ones, for instance, if it's a field that interests you. How can we have one-year masters of public health? There's plenty of one-year master programs in public health and global health, but many master programs in global health and public health also have flexible options, so you can do them in over 2 years, over a period of 2 years, part-time if you're working, etc. So many of those actually have some flexibility for people who are working at the same time. If you type Masters in Public Health on Google, you'll find a ton of options. Some in paid universities, some in public universities, and with different degrees of quality. So you want to look into that as well. Someone is saying, Martina, I get your point. On the other hand, I've never gotten a job any other way. It's always been application, interviews, job offer. Aren't especially serious organizations obliged to advertise jobs and have a transparent process? Yes, absolutely, they do. That's what I was saying. Many organizations, especially if they get public funds, so that includes universities, national institutes of health, government agencies, etc., many NGOs will have to have a transparent process. The truth is that in many occasions, they're also able to, there might also be internal applications that you're not aware of. And of course, these are people they already know and trust, that they might be quite a few steps ahead of you. I'm not saying it's not possible to get a job through the normal process of job application where you apply to just these jobs that are on the top of the iceberg. It is possible. It's just that the return on investment for your time and effort might be much lower. So the number of positive answers or invitations for an interview that you might get might be a lot less than if you actually know someone and or several people in the organization and you've worked hard to build a relationship. In any case, I think an important thing to remember is even if you're just going to follow that process and just apply randomly for a job online, you want to really research the organization. You want to show them that you know what they're about, that you've done your due diligence. And by this, I mean, what's the organization about? Does it have the same values as you do? How is the position a good match for you? So when you write your cover letter and your CV, you need to tailor them to the knowledge that you've gained by researching the organization. And then show them that you care not about you getting a job, but about you being able to add value to what they are doing. You have the message that you're trying to get across is, you need to hire me because I can really add value because of these skills or these practices, and because I'm very aligned with your ultimate objectives and so on. But you have to tailor it. You have to show that you know what the organization is about. There is a question that says, so how do we get a job without applying to it on LinkedIn? I think I already answered a little bit that question. When does the internship reopen at your organization? Oh, this is a question about Alanda. So Alanda is an organization that provides solutions to improve health and life and save lives around the world, and we do this by supporting other organizations. So we help the helpers in a way. And we are a small organization, but we work globally, mostly in countries in Francophone Africa, a little bit in Anglophone Africa, and in Latin America. And we provide support services of different types, development of trainings, technical advice, evaluations, needs assessment, etc. We have 8 internship positions per year, so 2 at a time, and these open every 3 months. The next one will probably open in, I want to say October, end of October, for a start in November. So just if you're interested in knowing more about Alanda and our internships, just stay tuned to our LinkedIn page or sign up to our newsletter. I don't want to talk too much about Alanda today because there's quite a lot of other questions. What would be the best strategy or advice for landing a first job as a fresh master's graduate? Same advice. Build your contacts and start building your contacts while you're still doing your master's. Connect with your professors. Are some of your professors working also outside of academia? Do they have connections that work outside of academia? Can you start talking to those connections? I mean, your professors know you. That's a great place to start building your network. Be active on LinkedIn. Create connections on LinkedIn. When you send out a connection request to someone, don't just send a connection request. Tell them why you want to connect with them. Look at their profile and say, oh, I think what you do is really interesting. I'm just starting. my career in global and public health, I would really like to connect because I'm building my network. And, if you're really interested in what they do, ask them out for a virtual 20-minute coffee so they can tell you more about what they do. And you'll learn about what careers and positions and jobs and organizations look like. So that's a great place to start. One of the other things that I see for fresh master's graduates is that people tend to think, oh, I have no experience. So I want to challenge you on that. Even if you've never worked before, or you've never worked before in the global or public health field, you have a lot of experience. You have a lot of transferable skills. So think about things that you've done in your life or in your master's that is actually, that are skills and that become experience. If you did a research project, there's experience right there. There's skills around, qualitative research or quantitative research, or, summarizing tons of information, writing. Those are transferable skills. That's an important experience that you want to highlight. If you have led a team of your peer students to conduct a project, that's also an important skill, and it's coordination, it's leadership, it's, keeping other people motivated, getting things done on time. So try to reflect a little bit on the experience that you already have and the skills that you already have, even if you're just finishing your master's. Are all job possibilities that we can have in this field about consulting? What are the practical functions that we can find in the field of global health? Oh gosh, no, there's plenty. So for those who didn't join at the very beginning of the talk, I was talking about the different types of positions and different types of sectors where you can work in. You can have positions or jobs that are really hands-on. So for example, you could be a project manager, or you could be, an outreach specialist. You could be actually reaching out to communities with prevention messages, or connecting communities to healthcare, these sort of jobs. You could be doing field epidemiology work. And of course, you can do epidemiology work with a public health master's, especially if that's an area where you want to specialize or you're particularly interested in. You don't have to have the epi diploma as well to do that. You can be project manager or program manager for an NGO, for a government office, inside the structure of the Ministry of Health, or for the state or local or city health authorities. You could have a project or program manager position inside a small NGO. You could be a grants manager or project manager for a foundation, or for a multinational organization, and this requires a lot more, managing a variety of different projects or grants, providing technical skills, but also coordination and follow-up and monitoring and evaluation skills. You could work in a hospital. There's a lot of positions in public health inside hospitals, and also more and more in global health, because some hospitals have partnerships with hospitals in different parts of the world, where they try to learn from each other, and someone needs to coordinate these projects. So there's also positions there. I guess those are quite practical. Then you can have more health strategy, or health policy, or health, working in the health governance, the global health governance structure, or the health governance structure in a single country or in a single city. So you might want to look into those types of jobs. There's of course research. It can be really theoretical research. It can be, clinical trials research for interventions that are public health interventions. Could be much more operational research, so where you actually go out with an NGO or with a National Institute of Public Health to test whether an intervention in real life, not in controlled settings, is working out. So a lot of variety, a lot of different things that you can do. You can be a technical advisor, where your job is not to run a project or a program, but you only advise in terms of the public health element or the global health element of that project or that program. Opportunities that involve field research engagement, work with communities. Many, depending on where you're based, there's a lot of variety, but normally working communities goes either through NGOs, whether small local organizations or larger national or international NGOs, and through government, through government offices or government agencies. Of course, you have, WHO, UNICEF, these type of multinationals have offices in many countries, but rarely they would, sometimes, but not always, they will have more sort of direct work with the communities. Normally, they would work together with local organizations to do that community work. So look at the NGOs for a good source of opportunities, and also the government in your own country. How can one find mentors in the public health for young graduates? Just ask, but don't ask for a mentor. Saying to someone you don't know, oh, hi, would you be my mentor? That is like, whoa, wait a minute, that's a lot of responsibility, right? So yes, of course, if you find a mentorship program, and there's one great one for global health that's called Global Health Mentorship, GHME. You can look it up on Google. That one's pretty good. But you can also find your own mentors in a much more informal way. You don't need formal mentors. You don't need a person to have the title of mentor to actually be mentoring you. So just nurture this relationship. Start with the people you know, like your professors, other researchers in the university where you've been studying. If they do something that interests you, just reach out to them. Say, hey, can we have a coffee? I want to learn more about what you do. And then ask them for advice. Really, we all have our egos. We like to give out advice. So take advantage of that. Invite people out for a short coffee. Don't ask for an hour of their time, but just 20 minutes here and there, and just build on that relationship. Stay in touch, say thank you, all these little things that continue building that relationship. So you don't need to call them mentors, but you can convert a lot of your connections into being informal mentors for you without the need of a formal mentorship structure, by just connecting regularly, staying in touch, and asking them for advice on the things that you're struggling with. I think it's much easier that way. And again, you don't need one mentor. You might want to have a lot of different mentors, so you have a variety of different opinions, because people are strong, have strengths and weaknesses in different areas. So you're always better off with a variety of mentors than a single mentor. What would you advise for a postgraduate in international health who is looking for roles in medical writing analyst? There's a lot of writing opportunities. And a good place to start is by showcasing your writing skills. So starting with a blog or writing regularly on LinkedIn. So you create a bit of content that other people can see, because that gives you a bit of credibility. And there's of course medical writing for all the research journals, but there's also many organizations that keep a lot of content, a stream of content, WHO, many NGOs. So you might want to look for positions. It's usually more called like communications officer or content development or something like this, than medical writer, but there's some possibilities there as well. Biopharmas as well have a need for medical writers, for instance. So those are some good ideas. Are there any scholarships for attaining a master's degree in public health? Yes, there's quite a lot. It really depends on the university and country that you're targeting. So you just want to Google that. And some people are already answering your questions. So there was someone talking about Hungary. How do you recommend communicating about gaps in one's CV, which may be happening when transitioning? You don't want to talk about this necessarily in your cover letter. You keep that for an interview, unless you have like a 5-year gap. You don't necessarily want to draw attention to that. But if it's a very big gap, it's always fine to say in your cover letter, you know, I stopped for 5 years because I was caring for little kids, or I was building a family, or I was switching careers and studying this other thing. You know, these things happen. I mean, it's just life. So yeah, don't focus too much on it, and the other side won't focus as much on it either, I would say. Yes, the recording will be shared with registered participants, so don't worry, you'll get the recording tomorrow. Some master's degrees require you to have previous experience. How can you have previous experience? These are masters that are normally for people who are more in mid-career or switching careers from a clinical or biomedical field. So there might not be a good match, but there's plenty of master programs that don't require previous experience. And you can also have previous research experience from your bachelor's if you did like some project-based work. So make sure to mention that as well and to make that count. Can we overcome the barrier of experiences required in jobs? For example, if I'm a professor in academia, can I have chances to be hired without much more experiences? I think so. It's really about repositioning your skills. So thinking about your skills outside of your technical skills. So yes, you have qualitative and quantitative research skills, but what other skills do you have? Can you coordinate projects? Can you bring people together? What are your communication skills? Are you good at science communication? Are you good at communicating complex ideas? Are you good at bringing people together? So always think in terms of what are your transferable skills. And there's usually many more than we think we have. So the way I've done this exercise is you just Google transferable skills, and then you make a list and try to come up with an example for each of those skills. When have you shown that skill? It's a real eye-opener, so I really recommend that exercise. I'm trying to get through all the questions, so I'm answering them very quickly now. There's some people connecting. That's great. Do you have any other tips or resources for how to start a consulting business, how to determine fees and designing a project? I've had quite a bit of requests on this, so just make sure that you sign up for our newsletter on the alandahealth.com website, and because I'm going to probably be doing a webinar on this in a couple of months, so I'm not going to talk about that right now. About the project manager function, is this a job that one can get straight out of a global health master's degree, or would it require more experience? You usually have like a hierarchy of positions. The first, more junior positions are usually called project or program officer, and then you have the project or program manager or project or program coordinator. So if you're straight out of a master's, the ones that might be a better match for you are the ones that says officer. But this is just a big generalization. It's not always the case. So always make sure to read really in depth how much experience they're asking. And the other thing is, even if people are asking for 5 years of experience and you have only 2 or 3, if you're really good and you can show that you're really good in your cover letter, they still might be intrigued enough to call you in for an interview. And then you got your chance to prove yourself. So don't wait until you actually fill out every single qualification in a job application to apply. That's like a description of their ideal candidate, and those ideal candidates very rarely exist. If to work as an epidemiologist, should I have a master's in epi, or is it enough with a master's in public health? If you took enough epi courses and you've built up your epi skills, and you can show that through experience, through trainings, through whatever it is that you do, through the way that you communicate, then I don't think a lot of people necessarily require an epi diploma. It might be the case for particular government positions where they need to fit very well into a case, but otherwise people will be happy if you have the right experience. How to find your niche area in global health? Because global health master degrees are so interdisciplinary, is it hard to know what jobs to apply for? Yes, it can be, can't it? just talk to people, I would say. Keep talking to people and figure out what, and then, try different things out. If you're not really sure where you want to go, try, a position for 2 years and another position for another 2 years. You have your whole lifetime to figure out what you want. And it might be a trial and error process, but you'll learn tons and you'll have fun along the way. So I would say just go for it. But also talk to people and figure out what their jobs look like and whether that sounds like something that's a good match for you. I'm running out of time here, so there's still quite a bit of questions. I'm not going to be able to cover them all. I'm sorry about that. We'll keep having these webinars every 3 months or so. So stay tuned and we'll try and save your questions for the next one, and we'll start with those. So apologies for the people whose questions I didn't get answered. What I just want to talk to you about is, because of these needs that we've seen, we at Alanda, we piloted a course in May that's called Thrive, how to build a meaningful career in global and public health. And in that course, which is an online course, we talk about a lot of these issues much more in depth. So you have access to all the content from the time you sign up, and then it's self-paced, self-managed, but we do send you regular emails where we recommend how you can go through the content. You get access to 6 video-based training modules addressing many of the issues that we've been talking about here, from mentoring to job hunting to how to write good cover letters and CVs, how to build your network little by little, etc. You get a workbook that basically takes you by the hand and helps you think through what you like to do, what are good matches for you, how to build a network, how to improve your CV, how to improve your cover letter, each and every aspect of it. And I think the most valuable part of the course is that we have a closed online community of peers who are all more or less at the same stage of their careers. Some are young public and global health professionals, some are career switchers, going into global and public health, and we support each other, we share resources, we help each other out. So it's a fantastic community that I think can bring a lot of value to an otherwise very lonely process of job hunting and job applications. And you get access to 2 webinars, one similar to this one, where we can go through any questions that you have, but more in depth, so because we have like 90 minutes, and a guest panel webinar where we bring together a group of people with very interesting career trajectories in global or public health. So you can get a feeling for how some career trajectories and how some jobs in global or public health might look like. And you get a lot of bonus materials, list of places where you can look for jobs, a list of names of common job positions in global and public health and what they mean, what they are about. We touched a little bit upon those today. So I think we put together a lot of very useful material. So for some of you, this webinar might be enough, but if you're looking for more support, stay tuned. We will send out more information on the course when you get the recording for this webinar. So tomorrow I'll send you the recording and you'll have a link to learn more about this Thrive course. And if you're struggling, we really recommend that you join. If you have any questions about it, please shoot us an email at projects@alandahealth.com, and we'll be happy to answer whether this is a course that is for you, depending on what your needs are today. It's a course that is suited both for people who are finishing their masters and people who are switching, so just very young people just out from their masters, and people who are switching to a global and public health field. So I think that's all I want to say on the course. Stay tuned, you'll get the recording tomorrow. And thank you so much for being here. Sorry if I didn't get to answer your questions. We'll let you know about future webinars like this. I really appreciate you being here, and have a fantastic day, everyone.